Peyronie's disease is defined as basically when a man has curvature with their erections. The cause of Peyronie's disease oftentimes is when a man has some kind of an injury, whether it's known or unknown to the patient, that causes scar tissue to form in one of the layers of the penis. That scar tissue isn't as stretchy or elastic as the tissue around where the scar is formed, and so because of that, that one area doesn't stretch as well as the rest of the tissue, which causes the penis to curve whenever a man has an erection. It also can cause the penis to lose some length with erections, and it can cause a little bit of narrowing at the area of scar tissue, or what we call an hourglass deformity. The important thing about Peyronie's disease is not only does it affect penile curvature as well as penile length with erections, but it also affects erectile function as well. The reason is because that scar tissue that's formed in that layer of the penis that doesn't allow the penis, that tissue, to be able to stretch as much. That tissue that's not stretching also affects blood flow to the penis. And so when that tissue isn't able to dilate as well as it used to, men aren't able to get as much blood flow to the penis. And so the erections take a hit and start to suffer in terms of both rigidity and maintenance of the erection. Peyronie's disease is diagnosed in a couple different ways. The main way is when a man notices that he's got more curvature with the erections than he used to. Usually that curvature is either cosmetically displeasing or it's getting in the way of intercourse, whether it becomes more difficult to be able to have intercourse because of the curvature, or it causes discomfort to either the man or their partner, or it's causing erectile dysfunction, and so the erections aren't rigid enough to be able to achieve penetration during intercourse. Also, we can do a penile ultrasound to further identify or further diagnose not only where that scar tissue is and how significant the curvature is, but also the blood flow to the penis to assess the entire situation. The great thing about Peyronie's disease today is there's quite a few options available to men. The options include minimally invasive procedures, including an injection called Xiaflex that we can inject into the plaque, into the scar tissue, to be able to disintegrate it or to be able to break it down in order to not only improve the curvature, but also to improve penile length and erectile function. There are also different surgeries that we can do, that I do, in order to improve that Peyronie's disease, improve that curvature, which includes something called a penile plication, which basically straightens out the penile curvature without removing the scar tissue. There's another surgery called a plaque excision and graft, where I remove the scar tissue, excise it completely, and then place a graft in its place in order to make up that space of the tissue that I just removed. There's also a procedure where I can place a penile implant into the penis in order to straighten out the penis in those patients that have both Peyronie's disease as well as erectile dysfunction that's refractory to the other types of treatment for erectile dysfunction. And in that procedure, I not only place the implant to allow for improved erectile function, but also I'll do what's called modeling to be able to decrease that penile curvature and get you to have not only an erection, but a straight erection. The treatment options for Peyronie's disease depend on the severity of the curvature, depend on the severity of the erectile dysfunction, and the man's overall wants or needs. The treatment options will basically be discussed with you, and we'll talk about the options based on that penile ultrasound and see which option from a invasiveness standpoint seems like it's the right fit for you, and that'll treat the diagnoses appropriately. The important part about Peyronie's disease is early treatment. The longer you wait with Peyronie's disease, the more risk there is of further curvature of the penis, of calcifications or hardening of that scar tissue to the point where it's more difficult to treat, and it can cause more or further erectile dysfunction. And so with Peyronie's disease, if you notice that you're starting to get more curvature than you did before, losing penile length, or overall having a combination of all of those symptoms, it's pretty important to try and be able to get that taken care of or treated or at least evaluated by a urologist or a men's health specialist as soon as you can.